The focus on the country is actually what we needed here in the country, on the front line, I would say.
WHO can dramatically improve people's health across the world over the next 5 years. Our entry point for this is the 13th General Programme of Work, or GPW 13.
The GPW 13 gives us a unique opportunity to improve the health and health outcomes of the population worldwide and also to reduce the inequities. And as the GPW 13 focuses on the countries, we have to do it together with the countries because the results have to be joint results.
GPW 13 is based on the Sustainable Development Goals, our call to action by countries, and health is one of the major goals. Although WHO needed to change the way it worked with countries, WHO Europe has been country-focused for years.
At the beginning of my mandate, I was determined to improve the health status, health outcomes of the population in the European region, and particularly to reduce the inequities. And I knew that this needed interconnected policies, and we had to develop a unified European policy framework which supports these initiatives. So this is how the idea of Health 2020 came about. And with this, we also contributed to the development of the SDG agenda and greatly contributed to the implementation of the SDG targets because we started a couple of years earlier through the Health 2020. So by the time SDGs came, we have already achieved certain results.
I have worked with WHO for over 15 years and in several countries throughout the region. Over the years, the regional office introduced many changes that placed more emphasis on countries, not just the work we do in countries, but also work with and for countries. For this to happen, it was important that WHO took into consideration the capacity of our own teams, but also our counterparts at the ground level, and also encouraged the member states to contribute to this joint venture. We have worked closer together, and the results were and still remain obvious.
And thank you very much for highlighting the values of WHO when we talk about health.
WHO work in countries was highly dependent on the capacity and knowledge of staff in regional office and HQ in Geneva. But Euro had this belief that work for countries was best done in the countries. In this sense, training and capacity building was imperative, not only of our staff, but of key stakeholders in our member states. And as resources are scarce, we became innovative.
The ambassador has arrived.
Networks are vital for using existing resources in one country to support other countries in tackling priority health issues. Networks such as the Small Countries Initiative.
The WHO Small Countries Initiative provides a platform for European countries with less than 2 million people for exchanging their practices in implementing Health 2020. Now the mandate of the initiative is to support the 2030 agenda and more recently also to support the new WHO General Programme of Work. Why do we have such an initiative in Europe? Because small countries, due to their size, they can actually implement WHO policies at a much quicker pace than larger countries. And we can consider them as policy laboratories with solutions that are actually valid also for larger countries.
I have spoken with the Secretary and it is all confirmed.
All heads of WHO offices are trained in management, policy formation, governance, and in facilitating technical support. Since 2011, technical staff in country offices, as well as administrative and support staff, now receive training to bolster their skills in delivering WHO's work in countries.
My name is Bella and I've been working in WHO as a program assistant and I'm supporting the health systems programs. For me, working in the country office means, and the whole focus to the country offices means that here we can see from the first hand the situation, what is going in the country, the needs of the country, the strengths and the weaknesses as well.
We were developed like a team, but basically we went even to kind of higher levels, so we call ourselves like a big family. Anything good happening in our personal lives we also share with colleagues, so it is really nice place to work.
Health 2020 was originally designed to overcome barriers and promote working together for health. Today, it still provides a vision for the regional office. Now, GPW 13 and the SDGs are setting the direction. We are well placed to deliver on our commitment. Better health for all.